Unfortunately, there is still an environment in the UK where general cannabis consumption and possession is highly criminalized. And so it's difficult for these patients within that small bubble who are receiving these private prescriptions to be acknowledged and also sort of assimilate and find ways to responsibly use their prescriptions and feel comfortable, like, where do I vaporize my cannabis? What do I do if I'm on the train or traveling or at the hospital? And so there's a lot of downstream problems and questions that need to be answered and solved as we expand the uptake and access for these treatments. There are a number of things that we can do to actually influence the endocannabinoid system and have somewhat therapeutic effects on the body without actually having to integrate cannabis into the human and patient themselves. So primarily what we see is that there is a large indication that lifestyle significantly impacts your health, but also your endocannabinoid system. And so there are instances where we've seen the endocannabinoid system has been measured in different styles, such as the diet of the individual, the nutrients that they're putting into their body, the amount of sleep that they're getting, all goes into the regulatory balance of your endocannabinoid system. And again, obviously your body as a whole trying to survive and maintain and flourish with poor nutrients and with poor sleep. Alcohol and drugs also have a negative impact on the endocannabinoid system, which we can measure. And some of the combinations of alcohol with cannabis and other drugs can exacerbate some of the adverse effects that are experienced or reported around cannabis consumption and use. And so diet, sleep, and overall general health and well-being and lifestyle have a massive impact on your endocannabinoid system, but also at a clinical level,